Hi, I'm Dr. Susan Hammond. Parents often call and ask us, what should I tell my child to prepare them for testing? Is there anything special I should do? And I have a few suggestions for you. The first is kind of to do the obvious. Make sure your child gets a good night's sleep. Make sure that they eat a good breakfast that morning. Try to get them up early enough that you're not rushing so that they're in a good mood and relaxed when they arrive in our office. All of this will help your child perform at his or her best so that we can get the best idea of what's going on with them. Kids then ask, why am I going? Why do I need to be tested? What I tell kids is that everyone has strengths and weaknesses. Everyone has things that they're really good at, that they're terrific at, that come easily to them. And everyone has some things that are harder for them. It might be reading, it might be math, it might be sports. There are lots of things that kids have trouble with. If we can figure out what a child's individual strengths and weaknesses are, we can help the parents, we can help their teachers, and we can help them to think about how they learn best and what type of classroom might be best for them. When I'm working with adolescents, I also point out that if you figure out how you learn and what type of working environment is best for you, you can get your homework done more efficiently so you have time left over for the things you actually enjoy doing. Kids then ask, what will the testing be like? I suggest that you tell them that they'll be doing a lot of different things with us. Some puzzles, answering questions, working out problems. There will be a lot of different challenges, and a lot of it will be fun. The testing covers a wide range of ages, so for each kid, some questions will be really easy, and some questions are just going to be too hard. They shouldn't worry about that. They should try their best on the easy questions and also try their best on the hard questions, but we don't expect them to get everything right. Things that we would rather have you not say, we're doctors, obviously, but let them know we're not the doctors who give you shots. We're not going to do anything that hurts, and make sure that they're clear about that. It's also better if you don't tell your child that they're going to go play games with somebody, because they might then think that this is a situation where they can joke around or give silly answers rather than serious answers, and we want them to give their best effort. Finally, a word about scheduling. Think a little as you're scheduling about what's going to work for your child. Please don't schedule them to get evaluated on their birthday. It just doesn't make them happy. And if something comes up at school, if it turns out that the date you picked out a couple of months ago is the best field trip of the year, please call us. We're willing to work with you. We don't want to be testing a child who's sitting there the whole morning thinking, I could have been in Williamsburg. So we try to be flexible. Hopefully this is helpful and you'll be able to reassure your child and have them come in ready to have a good time and ready to work hard. Thanks.